you guys just fire the questions away, and I will go ahead. You know what? I'll walk to you so everybody can hear the question. This way I get to move.
All right. My question is your view on statins with cholesterol. Because for African Americans, I know cholesterol is a big thing, big deal, and I'm just not quite in with statins.
Sure. I'll say something quick, and then I'll let her answer. Katie Couric did a study, 100 people on statin drugs, and I think what was the most popular selling statin drug? Lipitor. And 100 people not on it, only one extra person lived on Lipitor. Cholesterol is really not the major factor for heart disease. It's a multi-billion-dollar drug, and you guys are going, oh, it's more important is the ratio of HDL to LDL and the size of the particles and these other things, but in a nutshell, if you're focused on cholesterol, more than 50% of all heart attacks have absolutely nothing to do with cholesterol. But that doesn't make money.
Concur. I know as being on more the conventional side of medicine, and I know I take a lot of flack for this, I couldn't agree more with Dino, is that unfortunately a lot of these drugs are being given to people just like candy, and they have a lot of deleterious effects in the liver, for muscle energy and strength and causing a lot of muscle aches and pains, but also dropping hormones, which can be problematic. And unfortunately, if you're just looking at total cholesterol and an LDL and an HDL, you're not going to get the full picture. And we check the apoproteins, and he's absolutely right. Particle size, small, big, or medium size. Frankly, the smaller ones are much more dangerous. They can get in and cause a lot of trouble, so you need to be breaking that down. But you're better off using omega-3 fatty acids, fish oils, cinnamon. There's lots of things you can do naturally to help decrease that risk. The other thing, too, is a lot of times we have patients who come in with lipid disorders, and the number one thing that's driving it is thyroid disease. They have hypothyroidism or undiagnosed subclinical hypothyroidism, which is driving lipid disorders. You fix the thyroid, the lipids go away. So we're putting patients a lot on drugs when you're not looking at the root causes. So inflammation can be driven from lots of different things.
Great answer. And up your garlic, get your exercise, get your diet in place. And the difference of what she's saying and the difference of what's done in the conventional side is you actually get energetic, healthier, stronger. You feel an improvement of total health. It's not just looking at a cholesterol number. Does that make sense? That's the right way to do it.
Everybody's talking about Alzheimer's. I have a maternal side of Alzheimer's. Should I worry?
Well, the question is there's now testing. In fact, there's a company out of Canada that has come out with a brand new test to look at risk factors. But think of yourself: what is causing Alzheimer's? What's under attack? A lot of the times when patients realize they're having nerve issues or nerve conduction problems or memory problems, or if you look, there was a great documentary done by HBO. They did a documentary on Alzheimer's and the microglia, which are the immune system of the brain, and they were attacking certain parts of the brain that was bringing about this Alzheimer's symptoms. Again, some of these things can have genetic origins, but they can also have infection or chemical origin. And the thing is I think you want to keep, I'll pass this on in a minute, you want to keep the brain activity working on many levels, right? You balance all the parts of the body, hormonal, other things, but you also keep your brain moving actively, play the piano, these kinds of things. We know that firing those nerve things help. But in addition to that, I think people need to look at those infectious disease components, because if I was Dr. Corn sitting here, he would say over and over again, these are causative factors to these neurological symptoms.
And Olivia, I couldn't agree. Again, I mean, we're sharing the same brain tonight. This is really scary. Certainly Alzheimer's can develop from different brain breakdown, and lots of things can cause that. We also look at hormonal decline, testosterone deficiencies, infections, and various things. Using the brain is very important, but also inflammation in the body. There's actually some really interesting technology coming out for breast cancer detection. We have a company called Provista that we're working with, and they're looking at inflammatory markers that can signal the presence of breast cancer cells, and they're related to like IL-6, IL-12, CEA, human growth factor, and various other inflammatory response. And they're looking at Alzheimer's as well, using those same technologies. So the bottom line is a lot of it goes back to inflammatory responses in the body and how do you prevent those. And the simple things like vitamin D, proper balancing of hormones, and omega-3, there's tons of things. So don't think that you're destined for that. That certainly genetics plays a role, but there's a lot of wonderful things that are simple that you can do to help that as well.
You're saying chronic inflammation, all those cytokine markers, IL-6, the Germans have been doing those for years. They're part of some of their laboratory tests they use. One of the things we do in the office, besides laboratory tests, is we use thermography. Thermography is used by NASA. We can quickly take pictures of the body and quickly interpret shifts of inflammation. The temperature of the body can be picked up very easily. So these are other ways to look, but it's hard to do it in the brain because you have the skull. It's not as easy as other soft tissue.
I got a question. I had acute lymphatic leukemia as a child, and most of the doctors I've been to, and I have issues and stuff, and they say, well, we don't know what chemicals that you took back then causes a lot of the issues that you have, and it just drives me crazy. You know, so it's like.
Well, this is straightforward. Have you worked with anyone to test why this may have been a cause, like what issues may have caused it? What I'm basically saying is, come in, we'll screen you. That's what we do. And that's all we. That's our forte, right? So you come in, we screen you, and we'll narrow it down pretty quickly to what the causative factors are. And the reality is medicine isn't designed to treat the cause. It's usually designed to treat the symptoms because there's more money in it and you get reimbursed for it. Yeah. It's you want to test it.
Can you talk about some of the research going on with type 1 and type 2 diabetes?
What type of your research in particular?
New research that's coming out that's really going to help.
Well, first of all, and I'll pass this. Do you want to start? Because there's type 1 and type 2 diabetes, right? So in general, for everybody out there, one I like to call lifestyle diabetes, type 2, and the other one I like to call infectious disease because it's an autoimmunity. What you'll find is when people are very thin and develop diabetes, and now they're saying it's a type 1 diabetic, you look to infectious disease and you begin to test an autoimmunity. But the exciting research is in the area of stem cells from your own fat tissue, from your own bone marrow. And like we've seen already in Europe is that one of the problems with chronic diabetes, now lifestyle diabetes you can really do a lot with diet, exercise, nutrition, hormones, a lot, tremendous impact. And with type 1 you can help as well. But when you've finally burned out the islets of Langerhans, the pancreas that actually produces the insulin, you can't get those cells back. Wait a minute. There is potential to do that. And like I was saying to you, there are firms in Germany working on, and in China as well, they kind of compete with each other, but they're working on being able to take a stem cell from fat tissue, harvest it on a self-implanted device, and pump it right into the pancreatic tissue, like ongoing. And this stuff is not any available. It's not something that you can get tomorrow, but that type of technology is coming. And tissue can be regenerated. On the other hand, let me just say this. Stem cells aren't cure-alls. They don't solve everything, and they don't work all the time because it's a science that's developing, and there are different types of cells. You have the embryonic, which we will not touch because that's from an embryo. It's unethical. You have the umbilical, right, taken from those are all coming from another person. Those coming from your own fat and your own bone marrow tend to be safer and have a little bit of a different purpose, in the sense that you don't have a tendency to reject those as much as you would, let's say, an umbilical stem cell. But there's promise in them. The technology isn't fully there yet, but patients have reported, those who've gotten treatment, that they have a little bit decreased uses of insulin for a period of time after they're taking it. But it's an ongoing thing. So I don't know if that helps you. But as far as basic stuff, alpha-lipoic acid has been well documented, about 1.8 grams a day. You need your fish oils, you need your vitamin C, your antioxidants, and then cinnamon, and then you can go down the whole thing, vanadium, chromium. There's a whole lot of things. These are basics. Getting the diet right and making sure you have protein in the diet so your glucose levels don't do this, but stay nice and smooth and keep your hormones in balance, and people do really, really, really well. Those are just basic things.
And as I alluded to earlier tonight, the number one cause of prediabetes and diabetes really, and I mean certainly diet is a big role of that, and we do a lot of negative things to ourselves by not eating properly or getting exercise, but as we age, we lose our testosterone, which is the prime driver of glucose metabolism errors. So think about it for a second. If you are eating a meal, everything converts to glucose. How fast it gets there depends on what you eat. And that's where, as Dino had mentioned, if you're eating high protein, low glycemic index foods, you're going to have more of a kind of up and slowly, gradually declining, versus refined sugars, you're going to spike and drop, spike, drop. Every time that drop occurs after insulin deals with the glucose, your cortisol levels shoot up. That cortisol then puts weight in the midsection, which makes it also harder for you to lose weight, and it accelerates the problem. So diet is incredibly important. But once you lose that testosterone, the second you spike on that glucose and it's all sitting in that blood, it has to go somewhere. If it doesn't have testosterone, you're not going to move it from the blood into the muscle where the muscle burns it cleanly. The pancreas now has to deal with it. And the pancreas isn't very effective, and it's lazy. It doesn't convert it cleanly. It stores it as fat in the midsection, which then exacerbates all those troubles. So diet is incredibly important, but also testosterone is incredibly important in maintaining blood glucose and its control, and how the adrenals work with that. If you're incredibly fatigued and stressed and your immunity starts to drop, you're not going to manage cortisol well. You're going to get spikes of cortisol, which are also going to exacerbate weight gain and diabetes. So